Okay, guys, welcome back to Airborne Outdoors. I am your host, Zach. And as promised, tonight we are looking into this first aid kit. And then in the future video, we'll look at the survival kit that's in the Bugout Bag's butt pack. So we'll look into that. But let's crack into this first aid kit first. On the outside, we just have a little tick remover. And I loaded this out pretty quick, and it has plenty of room for correction and repackaging and repurposing, but let's just see where we're at. So we got just a full clamshell opening, and let's just dig into this big stuff we have in this pocket here. So we got a couple insect repellent pads, full pack of moleskin, a biofreeze, which sounds kind of funny to some people, but I think when you're moving and, you know, you're my age, you're getting sore, maybe your heel, maybe your knee, maybe your back, to just be able to throw that biofreeze patch on there. Just some sterile triangular bandage, good full-size bleed stopper. Keep going in this same back pouch here just to kind of get the volume of things out. So good supply of band-aids, looks like a dozen of them. Got some butterfly bandages there, like knuckle band-aids. Yeah, there's some different knuckle styles and regulars. Plenty of gauze pads here. We got some 3x3s, some 4x4s. Have our first aid instructions. So this is just kind of what we threw together with a bunch of other different first aid kits. Have some gloves, some nitro gloves. Might be useful in a dirty, bloody situation where you want to patch some wounds up and want to keep them clean. A little gauze roll, a little forceps, little really sharp tweezers, really good for digging out wounds, digging out things out of wounds. This is one of my favorite first aid items that don't normally come in a kit, but is new skin. You can buy just the generic new skin at the Walmart or Walgreens or something. Is very cheap, and it's liquidy. It lasts a long time. It's got a brush in there. Dry that wound out, you know, clean it up good, and just paint over it, and that stays there for a good long time. Some beeswax, lip balm, plenty of uses. A little vial. Have just a bunch of different sizes of safety pins. And then we have some needles in there too. So it kind of goes along with the rest of the kit too, as far as the repair and stuff that can be used with that. Scissors in there, help you cut your gauze rolls. And the little tape we have here comes in handy there. Some Q-tips. Couple of your like tongue depressor type popsicle sticks. Other uses would be like taping up a broken finger. Maybe cut that in half and use it for a broken finger to secure that bone to not move. Put it on both sides if you want, or whatever. A little piece of duct tape, kind of debated between a roll and a flat piece like this, but a flat piece like this I think is a lot easier to just look at the wound and say, okay, I want to, and just cut that and be able to and peel that and help secure some bandaging. Maybe if your band-aid doesn't stick well, or your gauze pad and your tape is a little slim, you know, go with some heavier duct tape. So that's about everything on this side. Go over here. Just threw in a full pack of butterfly closures. This is 12 the butterfly stitching type bandages. Threw a couple dude wipes in there because I have tons of them laying around and there's extra room, and always better to be clean. Got a bunch of baggies here just tucked away. So this baggie just has your alcohol wipes and like benzo wipes and pads, and just to clean them wounds up. And then this one has more like the creams. I do, now that I'm looking at this, I do have some room to increase the amount of creams here. Let me get that back on camera, but we got like some lip balm, some sunscreen, some burn cream, triple antibiotic ointment, hand sanitizer, and hydrocortisone cream. But yeah, I'm seeing here I can definitely throw in some more triple antibiotic ointment. So this is the reason you go through these kits too. Kind of got a little bit of everything, but now I'm seeing, you know, definitely put some more ointments in there. Maybe even buy one of those small tubes and throw that in there. Same with these pills. I have like a first aid supply case, and where I have little pouches that just have all of these different medications. But we got some Difene, which is this the one that's like an antihistamine? Yeah, this is like an antihistamine. We got an antacid. You know, these things, this antacid could come in handy. You ate some wild game that isn't sitting right in your stomach. Have an allergic reaction. I mean, this could really help you out. Some ibuprofen, some aspirin, some sinus decongestion, and some Diamode, which is like anti-diarrheal. But again, here, see, I'm seeing I got like one of each, and I have some more medications, more of each, plus more of a diversity. Could throw in some extra pills in there too. Have little pill cases. So, pretty complete kit. Now so that's all the small items, and then here is just like the larger wound care items. First off, got the 6-inch Israeli bandage, trauma wound dressing, 6-inch hemorrhage control bandage. So, but basically it's your Israeli bandage, if you know about those. Just the way they unfold, and you pack that wound. And I do have some Z-Pack. Is that in here? Yeah, that's in here. So here's my Israeli bandage. Along those same lines, like a big traumatic wound, having the tourniquet. Of course, in a bug out situation, you're hoping you never using a tourniquet, because, I mean, if there's a hospital open, you're probably not bugging out. And if you're using a tourniquet and you're unable to get to a hospital, you're in big trouble. But just because we don't know the exact situation we're in, maybe we're just fleeing a storm, fleeing some civil unrest, fleeing a natural disaster, and everything isn't collapsed yet, and we have some good first aid with us. So, I mean, just like any police officer or soldier, I mean, they carry their tourniquets and hope they never need them. And then, like I said, here's that Z-Pack dressing. Definitely do your research. You know, it's very easy to use, but if you don't know how to use it, then you're not going to know what to do. So just Google like how to pack a wound, and this is kind of what this is for. Just, you see a big cavity of a wound that's not just a cut, but it's a deep opening in the flesh, and maybe in the thigh or the abdomen, or you know, the arm, and you can pack this in there, get that all packed tight, maybe throw that Israeli bandage over the top of that. If it was really bad, you'd put the tourniquet upstream past the next joint. And again with them traumatic wounds, is just a couple sets of hyphen vents for like puncture wounds, bullet holes. So these are the chest seals. You see that hole. Normally you'll see just the small entry wound, and hopefully if it goes all the way through, then this is a set. This is a chest seal twin pack. So you open this. It's got pretty detailed instructions on the back here. You know, you see the wound, you clean it off, patch it up, you know, follow the instructions of how to make the vent work, and then look for that exit wound, and then you got a couple of those. So right now, guys, let me just kind of half pack this thing back up, and just kind of touch base and say, like, okay, I'm really glad I looked into this, because I was packing that whole Bugout bag pretty quickly, and I see here that I definitely skimped on the these medications, especially the ointment, the triple antibiotic ointment. It looks like I got quite a few of cotton swabs, but yeah, I need some more. I got plenty of stuff here to clean up wounds, but I could even add some more. But definitely add some more triple antibiotic ointment. Possibly add some more different medications. I do have a couple of prescription medications that I'm a recent stroke survivor, so I'm on a couple. I mean, a couple of them aren't even prescription; they're just like aspirin and Benadryl and stuff like that. But maybe I could throw a day or 2 or 3 of some prescription medications in here too, because that wouldn't be a big deal just to grab a few of them. Pick a couple in the morning and a couple for the morning for a few days and a couple for the evening for a few days and call it good. So I'm not even going to repack this all back up, because I see now I might upgrade some of these bandages because I have some higher quality ones. Maybe I just leave these in here and just add another half a dozen of those higher quality fabric ones. Add a couple more pills, add a couple more swabs, maybe add a whole tube. I think that's what I'm going to do to this kit of triple antibiotic ointment. Although that new skin would be helpful too, you know, because the new skin has like it's like a first aid ointment antiseptic liquid in it, you know. As a matter of fact, the first thing here says first aid antiseptic liquid bandage for small cuts and wounds. So again, yeah, this is for just little nicks on your, you know, little thumb slice when you're getting the fire going, or chopping some wood and you hacked your hand a little bit, but just a small wound. Like you got a big gaping gash in your thigh. You don't paint this stuff all over it. But so that's that, guys. Let me know what you think. Let me know what you'd add, subtract. Is it too much? Is it too little? I think I got most of the bases covered. I do have like a nasal pharyngeal tube that I'm not a great expert at. I was a what do you call it in the military? I was a not a first responder, the really basic first aid guy. What do they call that? Oh, combat lifesaver. I did go through combat lifesaver training, so like I learned how to do IVs and chest seals and you know, stopping bleeding and immobilizing fractures and exposing bodies with the ABCDEF acronym to go through the first aid, and you can Google that and everything. So anyway, guys, like I said, like I promised, we went through that first aid kit. It's part of that Bugout bag, and next I'm gonna just wipe this stuff away and I'm gonna make another video and we'll get into this first aid kit. Thanks for stopping by, guys. This is Airborne Outdoors. My name is Zach, and I will see you in the next video.